Good afternoon. My name is Todd Eisenstadt. I'm a professor in the School of Public Affairs, and on behalf of the Center for Environmental Policy and also the School of International Service, we welcome you to a special seminar which is going to feature Dr. Danielle Lederman, who is the Deputy Chief Economist for the Middle East and North Africa of the World Bank Group. Dr. Lederman will be presenting a very timely report which was just concluded on how transparency can help the Middle East and North Africa. We also have with us as a discussant Dr. Shadi Mokhtari, who's the assistant professor at the School of International Service and the author of After Abu Ghraib, a Cambridge University Press book. And without any further ado, because we had a little bit of a technical difficulty, I'd like to introduce Dr. Lederman and just say that if you have questions, please add them to the Q&A, question and answer area, and we will get to those after Dr. Lederman presents for about a half an hour, and then Dr. Mokhtari presents for a few minutes as a discussant, and then we'll open up for questions. Thank you very much. Dr. Lederman, I turn it over.
Thank you very much, Professor Eisenstadt and Professor Mokhtari, for having us today. It's a great opportunity for the World Bank to share our latest regional economic update for the Middle East and North Africa. I'm going to try to share my screen now. We've prepared a PowerPoint, and I hope that you'll enjoy it. Okay, so the title of the report is How Transparency Can Help the Middle East and North Africa. In my talk today, it has a different title, which is on the uncertain costs of the dual shocks. In tomorrow's seminar, my colleague, who's a senior economist in our office, will present the section of the report that talks about the long-term consequences of transparency from a developmental point of view. So both presentations are, in principle, quite complementary. So the first thing I gotta say is, it is not a grammatical mistake when in my title I have on the uncertain costs of the dual shock singular. The reason is, hold on a second. The reason is that we believe that the two key economic and socioeconomic and social shocks affecting the Middle East and North Africa are first, the spread of the pandemic, which shut down major centers of global economic activity for prolonged periods of time. In the graph, the picture you see is taken right out of the New York Times, that they have a very nice tool for tracking the spread of the pandemic. This picture comes from May 8th, 2020. And so that was the first shock. And this, as China in late December and in January began to shut down, demand for energy, for fossil fuels in particular, collapsed. And this brought about a decline in prices of oil, and due to technological structural changes in the global oil market that predate the advent or the spread of the pandemic, OPEC, including OPEC Plus, including Russia and other major oil exporters, lost the ability to control global prices. What am I talking about? I'm talking about the shale fossil fuel technological revolution, which transformed the United States into a self-sufficient energy producer and the world's largest producer of fossil fuels. And these weaken OPEC's ability to target and control global prices without coordinating actions with dozens and dozens of other global oil exporters. And so it's a dual shock, because the main shock was the pandemic that reduced aggregate demand, which put OPEC Plus cartel against the wall and they couldn't resolve it. And so that led to further price competition between Saudi Arabia and Russia, and prices collapsed. And this is what the oil market has looked like since then. This graph shows in the dark black line the oil spot prices for delivery at the date in which that's covered by the graph. The other lines, the blue, the yellow, the green, and the red, show the futures curve, what analysts, oil market analysts, and market participants in futures, in a sense, were telling us what was their expectation for the long-term growth, the long-term price of oil. The blue and the yellow line were the futures prices curve as of September 25, 2019, that's the yellow line. And the blue line was the curve for the future expected oil prices as of January 21, 2020. The green line is the same curve of futures prices as of March 9th, 2020. And the red line is the futures curve as of May 7th. And so you can see that the market's expectation for the future oil prices collapsed. And this coincides and was brought about by fundamental changes, first technological changes that predate the current crisis, and then the collapse of global demand. And so that's why we call these dual shocks, the dual shock, because the fundamental driver of the collapse of oil prices was the collapse of demand, which was brought about by the pandemic. Now, this is another graph that we'd like to share. It shows the differences in World Bank growth forecasts of GDP growth rates forecasted as of October 2019 versus April 2020. This curve traces out the difference between our April 1st, 2020 GDP growth projections for Egypt, Lebanon, Morocco, and Saudi Arabia, compared differenced with respect to what we had published were our forecasts for those countries for the years 2019, 2020, and 2021. Since the April forecasts were done once we had a lot more information than we had in October 2019 about the spread of the virus, the social distancing policies, the collapse in aggregate global demand for oil, and the collapse of oil prices. Now, one thing to note is if you look at the yellow curve, this one in my screen, those are the changes in growth expectations for Lebanon. And you can see that that in April 1st, 2020, we downgraded severely our estimate for how they performed in 2019, prior to the onset of the crisis. And then this number here is about 11 percentage points. So relative to our expectations for the growth of Lebanon that we had in October, we downgraded our expectation of growth by 11 percentage points. These changes in growth expectations can be interpreted as our expected aggregate GDP losses brought about by the dual shock. Now, this curve is Morocco, which essentially we're expecting that it was severely hit for 2020, but it's expected to recover in a V-shaped way relative to our previous expectations that we had for 2021 as of October 2019. And this is the curve for Saudi Arabia, where the downgrading our expected growth rate that we published in our report is less than 2 percentage points lower than what we had expected in October. Now, this downgrade for performance in 2019 for Lebanon is important for understanding the uncertain costs, because what's happening is that the pandemic combined with the oil price collapse is spreading economic misfortunes throughout the region, but certain economies such as Lebanon that had pre-existing conditions, economic conditions, in the case of Lebanon, macro financial conditions that predate the advent of the pandemic and the dual shock, you can see that we were already growing pessimistic because we also downgraded the performance of the economy, our estimate of how Lebanon performed in 2019, prior to the onset of the global pandemic and prior to the oil price collapse. So part of the reasons why in this talk we're saying that the costs are uncertain is because some of the costs that are captured by these downgrades in growth expectations are due not only to the shocks or the dual shock, but also because certain economies in the region had pre-existing economic issues that are now confounding, mixing up with the effects of the crisis. We have 4 key messages that I'd like you to remember if I can. One is what I just discussed now, which is that changes in expectations about the expected performance of an economy during 2020, even 2021, relative to the expectations we had or anybody had prior to the advent of these shocks, is a good proxy for the expected costs. But they remain expectations and they remain uncertain because the actual diffusion or absorption of these shocks throughout the economies of the Middle East and North Africa, and indeed throughout the world, are still fluid, because we still don't know exactly how the pandemic, the social distancing policies, the reaction of societies to those policies, how they will play out in the course of 2020 and well into 2021. Just to give you some sense of the numbers, the World Economic Outlook, which provides global expectations for growth, published by the IMF in mid-April, as of January, in their January Global Economic Outlook or World Economic Outlook, the IMF expected the world economy, world GDP, to grow at 3.3% in 2020. By April, they downgraded that to -3. So a good proxy for what the IMF thinks is the costs of this global pandemic is approximated by the difference between those two numbers, which add up to 6.3 percentage points of the 2019 global GDP. Our own expectations is what I discussed earlier with respect to those 4 countries. In October, in our forecast, we had expected the Middle East and North Africa region as a whole to grow at 2.6% in 2020. By April 1st, our expectation was downgraded to a contraction, a recession of -1.1. And that's why in the report, we talk about our expected costs as of April 1st for all of the MENA region to be approximately 3.7 percentage points of the region's 2019 GDP. The second message is that uncertainty rules and will continue to rule probably well into 2021. Because in order to have very precise expectations of what's going to happen in each country, in each region of the world, we would need to have a firm grasp of what's going to happen with the global economy, what are going to be the policy responses at the national level, and importantly, how societies are going to respond to those policies. Obviously, in the second point I made, it's virtually impossible to predict all of those things, in part because societal responses to the public health interventions and to the global economy shocks are highly uncertain. And in society's responses to shocks of this magnitude, trust in the information and transparency of the public sector are paramount. In economies or countries where there is a lack of trust in the state, even when the authorities are giving accurate numbers of the spread of the virus, what they're doing about it, when, and what they expect the population to do, are interpreted with a huge grain of salt when there's a history of lack of trust in what the state or the public sector communicates to its citizenry. Now, the fact that there's uncertainty around these predictions or these forecasts of the economic costs and social costs of the crisis it doesn't mean that we're totally in the dark. First of all, we know the direction of the economic adjustments. They're all negative. Most economies around the world are now predicting that economies from around the world are going to perform much worse than they were expected to perform before January. In addition, not only do we know the sign or the direction of the adjustments, even though those forecasts are fluid and we cannot know for sure what's going to happen in the rest of 2020 and 2021, we know something about the correlates of those expectations adjustments or the expected costs. And they have to do with the health system. And I will show you some evidence that, at least for MENA, as time has gone by, the correlation between the quality of the public health systems at the country level and the expected shocks are correlated. And the expected costs of the pandemic combined with the oil price collapse are not only negative, but highly correlated with the pre-existing capacity of the public health systems to absorb the health shock. Now, regarding national policy responses, we have a little tidbit in the report in which we advocate for sequencing without delay with public sector transparency at a premium. Sequencing without delay sounds like an oxymoron, but what we're saying is that the proper policy response in the short run is to safeguard lives and accompany that with policies to safeguard livelihoods. But these are not the standard policies that are in the usual arsenal of both the IMF, the World Bank, and most finance ministries around the world. And I'll talk a little bit more about that nuance. But the point is that after, and hopefully sooner rather than later, the pandemic will end when either herd immunity takes hold or a vaccine is widely spread around the world. But until that time, we still need to think about what policies each country would want to pursue after the crisis period end. And because those types of connections between the now, the crisis now, and the long-term future of any country, and in particular the MENA region, one needs to start now planning for a post-pandemic era. So from an analytical, almost academic standpoint, it is worth taking a step back and thinking to ourselves what we knew before the crisis based on research. First, IMF research published as late as 2018 warned us or told us that historically, economies have routinely failed to predict both the timing of recessions and the magnitude of recessions. And that's true even without pandemics. And importantly, around periods of the onset of recessions, there's great uncertainty across economic forecasts because forecasters are so bad at predicting abnormal downturns. From World Bank research, also published as late as April 2018, work led by Carlos Weg, who's a professor at SAIS, talked about the phenomenon of black swans. These are defined as unexpected, rare, but huge or large economic shocks that cannot be characterized well before they materialize ex ante. In other words, because these are so rare and so big, there's no way before they take place to know either what the growth trend will look like during the pandemic, which is the current realization of a black swan, nor its volatility. And without having that information ex ante, this realization implies that policy has to be quite abnormal. So these are some of our conceptual implications that we discuss in the report and that we've continued to hone as we continue to do research. First is because black swans are both unexpected and of unknown magnitude. with unknown uncertainty, these risks cannot be insured. You cannot buy a country level insurance against a pandemic. The closest it comes is that countries invest today to set up a response system in case in the near future there will be a pandemic. That's why it's so important that governments have public institutions that are constantly out looking out for the advent of the next pandemic, and to have national reserves of respirators, ventilators, PPEs that can be quickly deployed. Private hospitals or even public hospitals alone, like a single country, cannot, before a pandemic occurs, don't have the financial firepower to maintain a huge inventory of such hardware. The same thing is true for countries. There's no level of ex ante or pre-pandemic national savings that is efficient or optimal to combat the black swan or to counteract these black swan events once they appear or materialize. So this is true because you cannot self-insure or buy insurance because it's too inefficient, because it could be 100 years till the next black swan. Therefore, this is not the time to look back and say, this country or that country had bad fiscal policy, they didn't save enough, they didn't see. Once the black swan appears, that is all water under the bridge. Second of all, an important distinction is that between disaster relief versus Keynesianism. Macroeconomists are used to thinking when a recession takes hold and that you need to sort of use a government fiscal policy, even debt, public debt, to infuse the economy with extra aggregate demand in order to keep the economy afloat and bring about a recovery. But that's very different of the type of relief that you provide, say, when after a famine, after an earthquake, or after a hurricane, where you have to maintain livelihoods by providing enough financial firepower to be able to buy food, distribute medical equipment, and those kinds of things. That's very different from a Keynesian problem. And Paul Krugman has said it best when he said in the popular media that what the economy and the global economy is facing now is a policy-induced economic coma, because what social distancing policies try to do is to reduce social interactions. So it's a purposeful inducement of economic paralysis until we get a handle on the spread of the pandemic. And so the type of fiscal policy that's required under that circumstance is very different than the Keynesian types of policies during normal recessions. Another important thing to keep in mind is that such disaster relief is very different from structural reforms. And it ties up to my previous point about that during the pandemic, during social distancing policies, during disaster relief, that is not the time to start tinkering with very deep structural reforms of institutions, with fiscal austerity and the like, unless it's absolutely necessary. Now, because there's planning time, looking to, as I mentioned earlier, there's a lag time between planning a policy program for normal times and the implementation. It's important to not focus on disaster relief, the medical response, assistance to poor and vulnerable families in order to sustain a minimum level of consumption, to keep the economy afloat. That's disaster relief. But start thinking about what the policy framework for the long term should look like, say, sometime in 2021 and beyond. Finally, and this is a little bit depressing, one has to be prepared for prolonged lockdowns and leakages or other policy errors. It is very difficult in the middle of a pandemic, when you're thinking about disaster relief, for there not to have perfect policies of targeting. and to have zero corruption. However, what is true is that now more than ever, during the period of disaster relief, information transparency is at a premium because of what I mentioned earlier, that you want the public sector response to be consistent with society's response. Otherwise, there's going to be a tug of war between the policies, their intentions, and how society responds. And that is the worst combination in terms of both bringing the pandemic under control until there's a vaccine and safeguarding livelihoods. Just to give you some more flavors about how fluid the economic expectations are regarding the overall costs for MENA, but for the world. On the graph that you see before is a restatement of the previous graph, but it shows the expected cost for MENA as a whole. This is the line. This is about 3.7 percentage points, the numbers I discussed. And then some duration of underperformance in growth for MENA as a whole well into 2021, when we compare our April 1st forecasts to our previous October 2019 forecasts. And these are for the different groups of countries. This one, the one that has the biggest V shape of the cost, is for the developing countries that are oil exporters, such as Algeria. Okay. Now, in the next graph, this one is the MENA as a whole. This red line is the same as this red line here for MENA as a whole. The blue line is what we were saying as of March 19, 2020. So barely 2 weeks before, less than 2 weeks before April 1st, in 2 weeks, our expectations for the aggregate costs in 2020 for MENA almost doubled. They went from 2.1% of the 2019 GDP to 3.7% of the 2019 regional GDP. Similarly, we adjusted, and this is only in a 2-week period just for the World Bank forecast. Now, the issue of uncertainty during these periods of crisis, of unexpected pandemics, affects like the World Bank, the IMF's, our expectations, which will remain fluid until the year's over practically. The private sector is not immune to that, to the uncertainty rules conclusion. So these numbers just tell, we're comparing private sector forecasts published in March relative to what they had published in December. And since for each country we have more than one, we have tens, if not dozens, of forecasters, we can compute the standard deviation. And so in this table, we're just listing the standard deviation, which is a measure of the dispersion or uncertainty around the forecasts relative to the growth downgrades between March and December. When this ratio is more than 1, it means that the uncertainty of this group of forecasters was much larger than the downgrading growth. So if you were looking at these numbers in March, you would have said, yeah, we're expecting a decline in GDP growth, but the numbers are not statistically significant because there's so much uncertainty. Furthermore, in these two scatter plots, what we're showing is the correlation between the change in private sector forecasts between March and December, the change in the standard deviation, meaning the uncertainty around those forecasts, and the growth downgrades themselves. Here, Lebanon, as I show you in our own numbers, is an outlier, but that negative correlation exists even without Lebanon. This means that the harsher the downgrade, the more uncertainty there was about that growth downgrade. Now, just because the costs are uncertain, because expectations about economic performance in the months ahead remains highly fluid, it doesn't mean we don't know anything about the direction of the economies. It's all down, right? And also, we can also tell what are correlates of those downgrades. We conduct some econometric analysis that yields the following results. This is with respect to the World Bank's March 19 forecast. This is the partial correlation across our MENA partners for the Johns Hopkins Public Health Security Index as of 2019. Basically, what this evidence is showing us is that the extent of the downgrade of the World Bank, our expected costs of the crisis as of March 19, was positively correlated with the capacity of the health system to withstand the onslaught of the pandemic. In other words, countries that were better prepared from a public health standpoint to absorb the pandemic, their costs are expected to be lower. As of March 19 of this year, of 2020, there was also a partial correlation between exposure to the oil shock and the expected costs of the crisis proxied by this change in forecasts, right? This is telling us that the higher were a given country's net exports of oil as a share of GDP prior to the crisis, the deeper the hole we were expecting. Now, let me show you the same pictures. Something to note is that Lebanon is right on the line. So after you control for pre-existing conditions and cyclical adjustments, Lebanon is not an outlier. You can see that Lebanon is right here in both graphs. But let me show you how these pictures changed in less than 2 weeks. So I'm going to move the picture fast forward to April 1st. By April 1st, essentially, there's no correlation between exposure to the oil shock and the expected losses of the dual shock. However, the correlation between the level of preparation and quality of the public health system, including being in partnership with the World Health Organization and having solid public information systems, were expected to fare better than countries that have worse, excuse me, I'm getting a phone call in another, all right. Okay, so the picture changed dramatically in a couple of weeks. So the conclusion is that yes, the cause of the pandemic and the collapse of oil prices is uncertain, but we know it's negative. And B, we know that at least for this small sample of MENA countries, the key correlate is the pre-existing capacity of the public health system to absorb the pandemic. And Lebanon is still not an outlier. Now, there's even more evidence, statistical but descriptive evidence, that the oil shock part of the dual shock is uncorrelated with the expected costs of both shocks. In this graph, in the blue line, we have it's a proxy for the income effect of the collapse of oil prices. So it multiplies the expected collapse of oil prices times the exposure to oil exports. And so you can see that this simple computation puts Kuwait, Qatar, Iraq as suffering a lot from the oil price collapse. But net oil importers, such as Djibouti, Tunisia, Morocco, Lebanon, and Jordan, were expected to benefit because they're net oil importers. But yet they stand, our expected losses from the shocks are quite high, right? And so what's going on in MENA is not that the oil price doesn't matter, is that it affects both the oil exporters directly through a reduction of their incomes and revenues, but it affects the rest of the MENA countries, including the oil importers, through indirect channels, including remittances, foreign direct investment, and official transfers, mainly from the GCC, meaning Saudi Arabia, Kuwait, Qatar, and the Emirates, that transfer remittances, foreign direct investment, and official loans to the rest of the region on normal times. So we're beginning to dig deeper about the changing economic expectations. There's going to be a little bit of arithmetic here, but I'll try to work through it very carefully and smoothly. So the total costs can be decomposed into what's the cost due to the spread of the virus and the public health interventions such as social distances. A portion that it's related to the collapse of oil prices, and I already showed you that this does not distinguish across MENA which countries are expected to suffer more. And then other factors, plus the cyclical adjustment that's due to downgrades in our estimates for 2019. So this is important to this component, these two components are important to understand the case of Lebanon that I mentioned at the beginning of the presentation. So we have an estimate of how the ex ante, meaning the pre-crisis growth adjustment, correlates with the expected costs. It's about 1.4 is the partial correlation. The gross estimate for Lebanon as of April 1st, based on World Bank forecast, was about 11% of 2019 Lebanese GDP. But once you factor out the fact that we were also downgrading its past performance in 2019, what remains is about 3.6% of its 2000 pre-pandemic GDP. And that is more or less the regional average, which is why in our regressions, in our graphs that I showed you, the Lebanon is not an outlier, even though this number, the 11.2 percentage points of losses, is an outlier. There's an issue now that it's very important for multilateral organizations, but also for the finance ministries, for the treasury departments of the countries, which is what is going to be the financing needs of the public sector during the crisis. So it's important to, when we have that discussion, to have some minimum definitions. One is that the financing needs of a public sector are usually defined as the expected overall fiscal deficits that needs to be financed, plus debt amortization, meaning that countries that already have a pre-existing stock of debt, some of that debt is coming due during 2020 and 2021. So the total financing, expected financing needs of the public sector is the sum of those debt amortization, unless you want to default, and the expected fiscal deficit. Now, the deficit can be broken down into expected expenditure and expected revenues, and this is the debt amortizations. Now, the expected expenditures, however, is going to be a component that's new expenditures in disaster relief, assistance to poor households, expenditures in PPEs, increasing the financial power of the public health system to respond. Everything that you hear Mayor Cuomo discuss about New York and the financing needs of New York is here. In addition, part of the expected expenditures may or may not include the expenditures of the state of New York, or of Tunisia, or of Cairo, or of the city of Cairo, or of Egypt as a whole, which are the regular pre-existing expenditure commitments. For example, the wage bill of the public sector, investment projects, plus interest payments on the debt, which is different than amortizations. So what the IMF and the World Bank are doing is we're trying to coordinate international actions to reduce debt amortizations during 2020 and 2019, particularly for very poor countries, and to convince private bondholders to offer a respite in terms of interest payments. And that would create some fiscal space to rechannel fiscal resources to disaster relief. There's a discussion about how much or what types of regular fiscal expenditures should be maintained. Our own view is that in the middle of the pandemic, it is not the time to start imposing fiscal austerity. The time will come where we have to look at this carefully. But it might be the case that if international assistance to the countries of MENA is not sufficient to support disaster relief plus regular, that there will be a combination of some form of of debt default. That's the case of Lebanon as we speak, and some delays in paying interest rates. But even with that, if the international assistance is not large enough, and if you're an American citizen, you can already tell that that the amount of financial assistance that Congress has approved for all of the United States seems to keep increasing. Now look at it through the prism of say Egypt or Tunisia or even Lebanon. They're going to be in a hard bind. They're probably going to have to make some very, very tough trade-offs between regular expenditures, disaster relief versus social distancing, if the population believes in what the public sector and their leaders are doing. If they don't, these costs are going to escalate and it's going to be even messier, right? And disaster relief, and that's because disaster relief is a function of changing expectations, and it'll start clashing against the regular expenditures that were pre-planned. So the costs of the crisis are a moving target. Global policy and societal responses are fluid and virtually impossible to predict, particularly in societies where there's a pre-existing distrust of the public sector because of lack of transparency. Transparency is now at a premium. There is some role that's being played out in terms of pre-existing condition. MENA as a whole has a pre-existing condition, which is oil dependence, because the oil savings of the rich countries get digested in the form of remittances, FDI, and other official transfers to the rest of the region. So the whole region has a pre-existing oil dependence condition that it's now mixing up with the pandemic in a very economically toxic way. In spite of the fluidity, we know that health system preparedness is a key correlate of the expected aggregate costs of the pandemic. And transparency and consistency with international standards, follow the World Health Organization, is part of being prepared for handling pandemics of this magnitude. In our MENA economic update, we talk about transparency, we talk about macroeconomic fragility, we talk about poor labor markets, and how lack of transparency and lack of data transparency has affected historically proper open discussions about policy options for dealing with poor labor market performance and macro fragility. And most economists will have their own pet rock list of pre-existing conditions that they say are now mixing up in a toxic fashion with the spread of the pandemic. As time goes by, we expect that the main driver of the expected health will remain the health system, with transparency at a premium. The key message: we can't wait for the pandemic to get out of the way to start planning for the long term. But there's one key complication, which is that we have to be prepared for the risk of prolonged losses and escalating needs for disaster relief in the United States, in the world, and in MENA, where the situation is even worse because of the accumulated distrust of the public sector. Thank you very much.
Thank you. That was fascinating. There are some provocative questions, and we'll get to those. But first, we would ask Dr. Shadi Mokhtari of SIS to please comment for a few minutes. And just to say before she starts, that as we started a few minutes late due to technical difficulties, we're going to continue just a few minutes after the hour. So thank you. We hope you'll stay with us.
Okay, great. Thank you for the opportunity to few of my thoughts about the report and you know, to go over this report at such a critical time. And I want to start with the caveat that I am not an economist. I do very interdisciplinary work, but economics is not one of my fields. So if you'll indulge me, I'm going to kind of take a more interdisciplinary approach to some of the major themes in the report. And I my comments are really geared towards, the totality of the report and particularly the emphasis on transparency. So some of it may be more relevant to the discussion tomorrow, but I do my best to keep it related to what we talked about today. So there's just a few questions I wanted to pose here. So the report certainly emphasizes transparency. And I think what, the question that is posed is, why, the underlying question we should be asking is, why is transparency such an issue? The Middle East and North Africa was kind of experiencing a watershed moment even before coronavirus really took hold. And the dual shocks of the report came into play. So, in a sense, the pre-existing conditions that were just mentioned by Dr. Lederman, are not only economic, but also political. And, if we want to kind of look at how can we avert the economic disaster that may be impending, part of the question that we have to ask is, why is, again, transparency such an issue? And to look at transparency kind of as a symptom and one component of kind of deeper, broader problems. And, as someone who looks at social movements and political change in the Middle East and kind of human rights discourses and politics, essentially, we're looking at a region where overwhelmingly states are run by governments that are undemocratic and lack considerable domestic legitimacy, derive a lot of their legitimacy from foreign relations and kind of the geopolitics of the region. And corruption is kind of a very central issue. And I think part of the answer, at least for why transparency is such a problem, has to do with, essentially governments and those who are ruling in many of these states trying to essentially send out a message that all is well, right? And if, if you have to tinker with data and numbers in order to kind of reinforce that kind of branding in a sense, and there's all sorts of much more advanced forms of branding that particularly some of the Gulf countries are experimenting with, like bringing in major international sporting events and major international musicians and artists for, to brand their states in a certain way, again, for international legitimacy purposes. But nonetheless, transparency, again, is a symptom of a broader problem. So one of the questions that I would be very interested in hearing the answer to is, Tunisia is also covered not so much in the data that was presented today, but in other parts of the report, particularly female labor force participation, that discussion. And I'm just wondering if you found, and of course, Tunisia post-uprising still is contending with all sorts of issues with corruption, but nonetheless, is kind of this, very young, very vulnerable, but nonetheless, democratic experiment. I wonder if, some of the issues with transparency in the Tunisian context are better, at least you have the data, if not the economic, growth and indicators you want, than the other countries. The other point that I wanted to kind of briefly touch on is, we are, again, in the midst of kind of maybe second wave of protests, of popular protests in several Arab countries in the region, the first wave having been in 2011, and then the second wave being kind of inaugurated by Algeria, and then Sudan, and then Iraq, Lebanon, cycles of protest in Iran. So over the last 2 years, once again, seeing a new wave of protests. And I think, there's a good bit of kind of overlap between the grievances of these protesters and these social movements, and what the report is talking about. I mean, even more in the second wave than the original 2011 protests, corruption, right, is central to the grievances of the protesters. And the perception, by and large, is, and particularly since, ideology is kind of fading into the background a little bit, not just in the Middle East, but elsewhere. The perception is that these are governments that are kind of in it for themselves, and they're, again, they don't have an ideological purpose to govern, but more or less just prolonging their own self-rule. And so protests, want structural changes. Protesters want very kind of fundamental changes. And a lot of, again, the grievances are, economic, but in a sense, there's this kind of understanding that social and economic rights concerns or grievances that are economic really increasingly are related to kind of civil and political rights demands and grievances. So, the report mentions that populations in the region are looking for a new social contract. Certainly that is true. And the question will be, with the coronavirus, will the impetus for that really kind of increase depending on how these states fare in their response to it? Very quickly, I know we're short on time, so there's a section on gender, particularly a subsection on kind of war and female labor force participation, as a result of conflict in Yemen, mostly Yemen, and to some extent there's mention of Syria. And that is something I want to take a little bit of issue with, in the sense that, yes, we have historical precedents for that, and obviously it's widely discussed in the US case, but more than anything, in addition to education, really there's these normative changes that have been taking shape in the region over the last decade or so. And the uprisings, starting in 2011 through the present, really contributed to changes in norms around, gender and the presence of women in the public sphere. So once they kind of exit the private sphere, enter the Tahrir squares of the region, for example, then they're not going to go back and say, yes, now our role is going to be limited to the private sphere. So this entry into the public sphere, I think, has very much been kind of facilitated by a lot of these social movements. And I'm not sure I would kind of link it to kind of this positive outgrowth of conflict or war in the region, which, if anything, really contributes to the rise in poverty in those countries that are, along with a whole slew of other problematic aspects of the conflict. I guess finally, I would just ask whether, and again, I'm not an economist, but whether, this is a time to open a discussion about a shift to more sustainable sectors of economic activity beyond fossil fuels, given kind of the environmental, both environmental impact for the world, kind of the environmental challenges of the region, but also just broader lack of sustainability of this one, the reliance on this or dependence on the single sector. So could this be an opportunity to open a conversation about moving beyond the fossil fuel economy, which I know has actually been a long-standing conversation, but maybe there's more of an impetus for it there. So I would, I can conclude there. I know we're short on time, but really broader theme of transparency. I think the question is, how can we persuasively make that argument and convince the governments that are in place, or maybe even elements within those governments that would be amenable to that line of argument, that transparency, not just in the economic realm, but other realms, is the way to go to serve their populations and perhaps even to, in a self-serving way, prolong their rule by transforming it. Okay, I will stop there. Thank you very much.
Great. Thank you very much. And thanks to both of you. Now, we are going to paraphrase a few questions that have been scrolling up through the Q&A area. I want to exercise the prerogative of the moderator and just ask one question as a prelude. And that is, it seems that in fact, in the MENA region, if I remember one of the graphs correctly, the effects of the COVID or the dual shocks reducing economic growth to negatives are worse worldwide than they are in the MENA region, where it's like 1.1%, whereas worldwide it's projected at over 3%, if I remember correctly. And I guess the question is, given that health preparedness or health system preparedness and underlying structural problems of the kind mentioned also by Dr. Mokhtari and the sort of the cycles of grievances that have been present before the pandemic, it seems that those may be more important than the oil shock itself, or it may be that the oil shock is permeated the worldwide economy so much that we can't really separate it out and make it a regional MENA issue. So I guess my question is, one, about sort of the relative effect of the oil crisis part of this versus the other couple of main factors that were outlined, mainly these structural issues, precursor issues mentioned, for example, with Lebanon, and the fascinating finding about the healthcare preparedness and how important that is. So that's one question. I think the other question, a couple of other questions raised, about the transparency issue, about whether this might be the time to prepare for the post-oil economy, or whether this is maybe not the time for that. I think those are a couple of questions, if I'm just paraphrasing from Dr. Mokhtari. But then also from the audience, we had questions about sort of the healthcare preparedness. One person said, given that we've had these pandemics now, Ebola, Corona, et cetera, every few years, what can we do and how should we, as an international community, be more ready for pandemics? That may be beyond the scope of the discussion or the expertise but you have considerable expertise, and your publication, which I highly recommend, which is sent to registrants for this presentation. I recommend you look at it, but if you could comment on that. Another person critiqued the discussion of the use of variation of healthcare systems as a variable, saying that healthcare systems and their delivery and their access to citizens are so different by their very nature that it is impossible to make this kind of lumping comparison that is made in the report. So I wonder if Dr. Lederman could reference that one. Another one, I think, is the question raised about the IMF and World Bank's ability to overcome public distrust in order to offer some advice and sort of resources for recovery policies. How will these international institutions overcome this kind of trust deficit that this questioner said was quite important? Those are the first three questions. If we have time for more, we'll come back. I'm not sure we will, but thank you, and I'll turn it back over to Dr. Lederman. And if there's any other comments from Dr. Mokhtari, we also thank you and welcome those.
Okay, so thank you very much, Professor Eisenstadt, Professor Mokhtari, and the audience for pressing us with very difficult questions to answer. But this is the whole point of transparency. We have facts, we have data, we present our opinion about how to interpret those facts, we get a pushback, we have a debate. If these were taking place at the country level, over time, when you have more contestability of ideas for public policy, in the long run, our hope is that the policy framework improves when there's more contestability. So the question by Professor Mokhtari towards the end, it's key. How do we convince leaders, political leaders that now, let's just say, control power, and they have a vested interest in lack of transparency as a mechanism for sustaining themselves in power? I don't know if this is too much of a caricature, but that's the gist of the question. What we're hoping is that the political science literature that talks about how even the most kleptocratic regimes in theory have an interest in bringing about prosperity of society because their own power and their own wealth and legitimacy is proportional to the size of the economic pie. So what we're trying to do is to, with this report, and we hope in the future, is to convince the leaders and civil society more broadly that there's a minimum standards of transparency, a minimum standards of quality and availability of minimum level types of data that are required to have a constructive public discourse about what works and what doesn't in public policy, with the objective of growing the pie from which also political leaders can gain both legitimacy as well as wealth under certain circumstances. So we're hoping that that's, and it's probably wishful thinking, but we, for now, we'll keep at it if you guys don't mind. So that's the first question I wanted to address. Now, in Professor Eisenstadt's question about the world versus MENA, I just want to clarify because there was it wasn't very clear. The World Economic Outlook estimates of the growth rate for 2020 was published 2 weeks after we published ours. And these forecasts are very fluid. So I cannot say for sure if we had waited 2 weeks, because I already showed you that between March 19 and April 1st, our own view of the economic costs, which by the way, are not the forecasts themselves, but is the change in the forecast relative to the forecast that existed prior to the crisis, right? So I cannot tell you for sure that it is true that the expected costs of the dual shock for MENA are lower than that for the rest of the world. But we do know that for China has been quite severe. Even if China doesn't have a recession, it's coming down from an expected growth rate of 7% to close to 0, right? And India is the same thing, coming down from Egypt for their fiscal year that ends in June. The World Bank forecasts are in the positive, but in October, Egypt was growing greatly. So the expectation was that it was going to grow almost 6%. In Egypt, their statistics go by fiscal year, which ends in June. And so the crisis had just started towards the end of their fiscal year. So for 2020, for Egypt, we expected a decline of 2 percentage points, but still in the positive. But for Egypt, we're also forecasting much lower growth in their next fiscal year, which begins June 1st to June 1st, 2021. Adding, and Egypt will be, as of our April 1 best guess, the cost of the crisis amounted to a little bit over 4 percentage points of its 2019 GDP, so slightly higher. But I cannot tell you right now that for sure we expect that. Now, we do think intuitively that there's no region more affected by the combination of the pandemic and the oil price collapse, because the rich neighbors and some of the less rich, less fortunate neighbors in the MENA neighborhood are highly dependent on oil, and indirectly a lot of the other oil importing economies are also dependent in oil. And our exercise that I show you is within MENA. And so we can't distinguish who's going to do worse based on their pre-existing net exports of oil, right? Because the oil price collapse spreads equally. But I have no doubt intuitively that MENA is probably, as a whole, one of the most negatively affected regions in the world. Now, the issue here is that the rich neighbors, the GCC, the Saudis, the Emirates, the Qataris, have really good public health systems. They have some of the highest testing rates in the world. right? Because they're rich, so they do have the extra beds, they do have the extra ICUs. Because they are located in the so-called third world, it's not the first time that they face pandemics or epidemics of diseases for which there's no pre-existing treatment. So they were very prepared, and they're very rich. So they're throwing a lot of their resources, and those numbers, that preparedness, appears in the Johns Hopkins Health Security Index. And that's why we remain convinced, in spite of all of the problems of this proxy, that it is a legitimate comparison to make. I think in the Q&A tool of Zoom, the question was that there's a lot of variance within countries. So public health in Cairo is very different than public health in Upper Egypt.
Oh, right.
Public health in Tunis is very different than public health system and infrastructure in southern Tunisia. I think that is the issue, because there's variance within countries. So how informative is the aggregate index? My response to that is that our unit of analysis is the country level, and we were surprised how powerful that index is, in spite of all of these caveats. So it's a good point, but there's something to that index that still has traction in the data, in spite of the small sample. So, but we totally accept the point that there's great variance in the quality of the public health system within countries. And in fact, in all of MENA, the sharpest inequities are observed across space, across territories, more than across households. And this is true when we compare the structure of inequality in MENA relative to the rest of the world. Then there were these questions about the post-oil economy, the environmental issues. These are very, very important issues. I think there's an issue for the global economy as a whole of what are the right adaptation and mitigation measures that need to be in place at the national level. In some places, what's relevant is just the adaptation to natural disasters and climate change, because the contribution of a small economy to global climate change is quite small. And this is why it's important to work with some sort of international coordinating mechanism that can bring the big players around the world that collectively decide to fight climate change seriously. Otherwise, it's just going to extend the problem forever. And the advent of shale has weakened OPEC, certain economic, let's call it economic rules and institutions, but at the same time has put a ceiling on the price of oil, which then exerts more competitive pressures on the renewable technologies. But my impression is that renewable technologies have advanced sufficiently, and there's enough interest globally by the big private sector to let them rip. And so I'm hopeful, but it requires, I don't know how else to put it diplomatically, international coordination efforts that the big players have to participate in. If that doesn't happen, then this is going to be a tug of war where the climate events, black swans, become more and more frequent until the point that they cease to be black swans. There was one final question that was very good and very important. I see that there's 3 new ones. I haven't gotten a chance, but there was one about the fact that the frequency of these epidemics or pandemics is not that low, that there's been some 17 or dozens of such epidemics or pandemics, if they spread across borders of countries in the last 2 decades. So the question was, how can then you say that you shouldn't be prepared? What we're advocating is that like the climate change issue that requires global coordination, there's a need for global coordination in preparedness over pandemics. And there's a need to strengthen the global institutions that are entrusted by the world to help with that coordination effort, particularly if there's no appetite on the part of hegemonic countries to play that coordinating role. Now, I don't know where that leaves us from an international relations standpoint, but we are sort of in a pickle. At the national level, it is important to think hard to have systems of crisis response, similar to what you would have for natural disasters, and to make reasonable investments in public health infrastructure that's needed to counteract the public health effects of pandemics when they do occur. But this is very expensive, because if pandemics of this magnitude are rare, in spite of the 17 of the last 20 years or so. So to self-insure against think of a single hospital cannot do it. They would need to have immense financial power to maintain a huge inventory of PPE, ventilators, and in warehouses. So they would have to be like the Amazon of hospitals. They would have to manage huge warehouses that most of the time would be unused. So in other words, the social costs of lack of preparation cannot be internalized by small players or private players. It requires coordination at the national level, it's not the global level. So it's the national government, such as what we've observed in the GCC countries, that need to make the ex-ante investments in public health infrastructure redundancy that goes idle for most of the time, but they come in very handy when there's actually a black swan materializes. So that's the way we view things. There's more questions there. We're running out of time. Happy to hang out longer if that's what you guys want to do. Thank you.
Many thanks. I think that we are running out of time. Maybe if these questions can be addressed afterwards, or if we can address them offline a bit, that would be wonderful. I do just want to thank both of our speakers. I want to draw your attention to the World Bank Group's publication, How Transparency Can Help the Middle East and North Africa, which just came out. And to remind you that tomorrow we will have a second presentation on another part of this report by Dr. Asif Islam, who's a senior economist for the Middle East and North Africa region of the World Bank, and also with commentary by Dr. Tamar Gutner, who is a professor at the School of International Service. So we just, without any further comments online or altogether here, we will thank you, apologize for the slight delay, and wish you a good day. And also just thank Dr. Lederman for his reference to the coordinated international efforts that are needed to help create leadership out of the pandemic with regard to public health and also with regard to climate change. And of course, he didn't mention any large players that need to be present, but we all know who we need to reference in asserting stronger leadership at the international level. Anyway, without any more direct references there, I ask for any final comments from either of our speakers. All set? Okay, thank you very much. And we will see all of you tomorrow at 3 o'clock for the second of 2 seminars. And we wish you a good rest of the day. Thank you.
Thank you.